I went straight into a graduate program after undergrad and did that for a year. Got out and started looking for jobs. And actually, I originally was hired through a temp agency. It was up in Seattle at the through the organization called PATH, which is a global health nonprofit. And after a year of working there, I got hired on full time doing vaccine research, and I really was enjoying my time there. I really thought that the work I was doing was meaningful. I loved the people that I was working with, and I loved being in Seattle. I thought it was a great city. I'm originally from California, and I'm happy to be back home now. But I continued living in Seattle for 5 years, and during that time, I also started teaching at Seattle Central College at night. Again, I had a master's, so teaching at a community college was an option for me. I really enjoyed that opportunity as well, and did really both of those for another 3 years, so a total of 5 years. And during that time, I'm teaching didn't change very much, but I kind of grew more through my full time work as a vaccine researcher. Kind of slowly progressed more into project management, and I thought those skills that I gained doing that, working with collaborators, and keeping timelines and deadlines, was really enjoyable. So it was a really nice time, and I really enjoyed living in my 20s. And I'm glad that I didn't go straight in, because I feel like I might have missed a little bit of my 20s had I been in medical school at that point. And I'm okay starting my 30s being in medical school.
In terms of statistics, I don't know the exact number, but I remember in our first year of, in my first year of medical school, someone asked the question at orientation of how many people came straight from college, and I would say probably like only a fourth of the room raised their hand. So at least at Rush, a heavy proportion of people did at least 1 year in between college and medical school. For me, I did 2 years. Part of that decision was, so there were a couple reasons why I wanted to do some gap years. Was of course to boost my application, to strengthen my application and resume, and get kind of that career experience, but also because I actually wasn't entirely certain if I wanted to go the medical route. At this point, I was maybe about 80% certain, and I thought to myself, I better be 100% certain, because this is a very long, very expensive pathway before there really is no end of the tunnel, but before kind of the tunnel gets a little bit lighter. But I figured, the biggest battle is finding what you want to do, because once you know you're certain about that, then, all things forward, like, I'll find a way there. I'll figure out a way. If I have to try and try and try again, I'll figure out a way. So I wanted to get to that point where I knew for sure. I applied pretty randomly to just kind of all over the country. I'm from California myself, but I was over in college on the East Coast. I ended up finding a job on the East Coast in New York, at Mount Sinai Hospital as a clinical research coordinator with the Department of Surgery, and it was a 2-year position, so this was perfect, so I wouldn't have to apply for something again the next year after that, since I wasn't planning on applying during my senior year. I had no allegiance to surgery. I had no idea kind of what I wanted to do. I just knew I wanted to be in the hospital and working with patients and make sure that, and kind of see, the daily life of being a doctor, or a healthcare provider, and kind of get that out of that. And honestly, I would say that those 2 years are probably the most transformational of my life. I discovered that I do 100% want to go into medicine, that in fact I even discovered the field that I want to go into, which wasn't surgery, which the surgeons will always tease me about. They say that they chased me away, but I got to know the interventional radiologists through the vascular surgeons. Interventional radiology is a field that's kind of very new on the horizon. In fact, it wasn't even a residency when I first started medical school. It became approved as technically I guess it was, but there were only like maybe 20 or something programs at that time. And now has become it's grown to about 80 programs now. Essentially, it's like procedures, but you use radiological imaging so that instead of making any incisions in order to access the body part of body that you're working in, you use wires and catheters and needles. So it's all very minimally invasive, and you kind of work closely with every single department hospital. So I discovered is like basically everything that I am today came from just randomly doing this job, randomly deciding to do this job. And like just a lot, I think I already talked kind of about the experiences I got that taught me that I actually like research. More than that, I feel like working with these particular mentors taught me to be more confident and advocate for myself more. And it kind of taught me that doctors are human too, you know, because I think before that I was kind of like ultra respectful to any doctor that I met. I was like, oh, you are, you know, you're way up there. But all doctors are human too, and all teachers are human. And you can, you know, take things from everyone that you want to do when you are a future physician, as well as kind of the things that maybe you don't want to do. And I think that's an important thing as a learner in general, to just always be aware that, like, you know, no one person is like the all-consuming role model, and no one person is all-consuming like the anti anything you want to do. So that was kind of a tangent, but basically just to say that I agree that kind of having that gap year experience really added everything to my application. I don't think it would have been possible for me to get into medical school without it. At all of my interviews, all I talked about was my experiences at Sinai, talking about specific patients that I worked with, specific doctors I worked with, in addition to other members of the team. So I think that was the other, sorry, I'll finish this up soon. That was the other important thing that I got out of this gap year experience was in deciding whether I wanted to go to medical school, I also was able to kind of consider the roles and responsibilities of other members of the team, including physician assistants, MPs, RNs. Everyone on the healthcare team is important and has an important role. So if your goal is to be involved in healthcare, there are multiple ways to do that. And you kind of have to really ask yourself, why do you want to go this particular route? And this experience allowed me to kind of explore that.
Thank you.
Great. Well, that sounds like an awesome couple of years that you had. So I took 2 gap years, and it really wasn't originally planned. I took the MCAT my junior year, trying to go straight because maybe even the end of my sophomore year, I don't know. To get into medical school straight, you have to apply your junior year. And I hadn't even taken all the classes that were on the MCAT, and I didn't do very well. So I decided to hold off on applying, finish my classes, build up my application, and actually apply when I felt my application was complete. So I didn't finish taking the MCAT until it was too late after my senior year, or I don't know, however many years it takes to get into medical school now. But during my gap year, I continued some research that I was involved in. I did a lot of community service and volunteer work because I realized I didn't do very much of that while in school. And that's kind of a big part of the application that you should have. I worked during school and was kind of the research coordinator of my group. So I had that experience, but I wanted to build up the other aspects of my application. So I got a lot of I volunteered in a clinic as a scribe as well to get more clinical volunteer experience, as well as working in the community with an underserved population as well. I got certified in yoga instruction and became a yoga instructor for one of those years, which actually they seemed to like in my interviews because it was something a little bit different. And I think the coolest thing I did in those gap years was, as soon as I got into medical school, I know this didn't go on my application, but I spent 5 months traveling in South America kind of for myself, to kind of give myself some time to have fun. And I think that was really important. Applying to medical school is probably one of the most stressful things in your life. And then you get to medical school and it's a lot of work, and you want to go into it feeling rested and ready. And by 2 years, I was pretty anxious to get back to doing something and moving towards kind of my ultimate goal of becoming a doctor, but kind of taking that time to have fun and travel was pretty useful. And actually, while I was traveling, a big earthquake happened in Ecuador, and I ended up doing disaster medicine volunteer work over there, which now I've talked about in all of my residency interviews, going into emergency medicine. And I learned a lot working for a month in disaster med, and it's kind of what helped me choose my career. So, something in a little bit of everything. Have some fun, build up your application with the things that it's missing. And I know everyone said this, but a lot of people take time off, and you may feel like you are wanting to go to medical school right away and get it done, but they do value these extra life experiences. Unfortunately, kind of, but also fortunately for you, because I think they really do. It gives you a chance to enjoy your 20s and actually seek out the things that you want to do and figure out a little bit about yourself and help shape you and prepare you before kind of buckling down.
Thank you.
Right. I'll wrap this up. I think it's really neat to hear what everyone else's path to medicine is, because it is so varied. And I think for me, I had to take 2 gap years, not exactly planned either. But the first gap year was because I applied to medical school during my senior year. So because of the application process, it takes about a year. My first gap year, I actually was working sort of as a clerk in a doctor's office. But the nice thing about that was it actually gave me a lot of clinical experience. It really helped me understand how what we call outpatient medicine, which is when patients sort of schedule appointments to see doctors, to see how that side of medicine is run, and to have experiences with patients, even if it's not exactly medical, helping them schedule appointments, or really this experience helped me understand how insurance works and how in the US we pay for medical services. I think that's something that can be confusing. Even medical school doesn't really do a great job teaching you how that stuff works. So I think that was definitely a formative time in my life to understand the healthcare system in general. Because I didn't get into med school my first time around, I ended up taking a second gap year. And during that second gap year, I sort of fast tracked and really buckled down and condensed my master's thesis in a year. But I absolutely loved grad school, so much that if I didn't get into med school, I would have converted to PhD student. But I think the nice thing about applying the second time around was that now I had the doctor's office experience. I actually also spent one summer traveling and doing an observership in India and seeing how a tertiary hospital there functioned. So that was like a really great shadowing experience that I was able to talk about the second time around. And then the nice thing about the second time around when I applied was the fact that I had my grad school grades, which were pretty good, and just more experiences to talk about. And I think it certainly is nice to be able to talk about different things that you find important in your life. And I think the nice thing about grad school during my second gap year was the fact that I really fell in love with teaching and sort of education on a certain level, because I was a TA. And that was something I sort of talk about now in residency